Hey, it's been about an hour and a half, and you hear this blood curdling stream coming from down the hall, and you know, oh my gosh, that's my baby girl or baby boy. You run to their room, they're tugging on their ears, they're crying unconsolably, and you know, oh my gosh, this is another ear infection, not again. And it can be definitely a struggle for the parents, the family, and definitely for the child. You wake up the next morning, they're tugging on their ears, they're crying, they want console, they're fussy, they don't know what to do, their neck feels like a brick loaded with a little bumps, a lot of bumps. And so it's like, what are we going to do? Because this is the fifth one. This is the fifth round of antibiotics, and we don't know where to do or either return to. Well, I'm going to give some answers for you today. Natural ways that you can help alleviate the pain or alleviate the symptoms of ear infections, but also prevent those problems from happening as well. So let's dive in, shall we? Now, ear problems come, obviously, the ear infections are a result of two different problems that I look at as a pediatric neurologically focused chiropractor is one, the nerves, and two, the nervous system. One, it's the nervous system and the immune system will have an effect on each other, but it's also poor plumbing. The fluid is not allowed to drain down through the ears and bypass the stomach and go right to the digestive system. So a result of poor immune system and poor plumbing. So what are the causes of this? Well, we look from birth. You know, when a baby's born, especially if there's a trauma involved or even a C-section, seemingly harmless C-section, baby's lifted by the head, they're pulled by the head, there's a lot of torque, can definitely affect the neurology on the upper neck, that talk to the ears, talk to the immune system, but also allow for the drainage. So if these muscles are very super tight, they're not going to allow for that drainage to occur, and it backs up and creates excess amount of pressure in the ear, excess amount of fluid in the ear, some mucus in the ear, which is another name for bacteria candy. They love, it's like a petri dish for them. They like to grow in this stuff, and they will too. They'll take over. So what is the response? Or what is another way of birth, besides birth intervention? You got some notes right here. Health challenges in infant. Did they have colic? Is there constipation? Was there increased stress in their bodies? Because this will have an effect on how their immune system, or how the nervous system responds, and ultimately how the immune system is going to respond. If they're in a state of fight or flight, they're not worried about the little bugs and germs in their body. They're worried about the big stresses in their life, okay? And that can be a result of, just the environment or having colic as a baby. Detachment disorder can be a big thing too, where mom and baby can't leave the room without, our mom can't leave the room, our parent can't leave the room without the baby just wailing. Early antibiotics, believe it or not, hey, if that immune system's not allowed to develop, they're not going to fight that off. They're not going to develop their immune system with the way their body is programmed. That immune system in a child is so adaptable at a young age that they're able to fight those things off. But we have to allow it some time to do that for those to happen. Diet's a big one, okay? And even diet, the way they eat. Nursing is a great way to get some movement in this neck, the throat, to get the lymph draining as well. But also sugars. Dairy is a big one. So dairy too soon, dairy a lot. I know for me personally speaking, I used to drink and chug milk, but I always would wonder why I have this phlegm in my throat. And I just couldn't get increased mucus. And turned out I'd always have dark circles underneath my eyes too. And it found out I had a food intolerance to dairy. I couldn't process that the way I was supposed to. And it caused a lot of phlegm. Well, it backs up into my ears. And it backed up into other areas too, where it developed, I had issues with breathing and just getting this stuff out. Grains can be a problem. Sugars will definitely decrease the immune system, actually competes for vitamin C at the cell receptors, the white blood cell receptors, and vitamin C helps to fight off and triggers those blood cells to fight off the immune system, but it's loaded with sugar. I don't know there's a bug, so I can't help you there, body. Okay, and then chronic inflammation in the body. That's a big source, a big no-no for immune system catastrophe. So, hey, birth intervention, health challenges as a baby, antibiotics at an early age, you can't fight off their immune system and develop their immune system, and diet and sugars are a big cause of the problem. So what are the solutions? Well, you gotta go to a medical doctor. The medical doctor is gonna say antibiotics. And if that doesn't work, we got some more antibiotics. And if that doesn't work, we got tube surgery. Well, if the only thing you were trained in is, drugs and surgery, that's what your tools are. That's what you're going to provide. And, for those people that have done tube surgery and it alleviates the pain, definitely not shaming in the least bit. This is a parent's decision. This is not a doctor's decision. They're to inform you of what happens and what the outcomes are on what the surgery or the antibiotics as well. And quite face it, you're looking for answers. But if that's the only answer you're given, well, that's probably the only choice you're going to take. So we have to understand like what happens when you remove the tonsils that are actually a part of the immune system. What happens to the ears when they have holes in it, how it drains down into the lungs a little bit easier because you're taking it bypass. It doesn't go down the neck like it should be. It's going down the throat. Those types of things will happen as well. So what are some natural remedies that you can do as a parent to help? I'm going to go hit on these. Some of these I'm going to hit on a little bit more, but other of these I'm just going to give you, hey, this is the down and dirty. This is what you need to do. Position of the bed. This was actually recommended to me by a parent who used to be in here, and she used to be actually work for me too. So actually, this goes out to you. It's actually propping the mattress up about 2 or 3 inches at the bed if your child is relatively like not all over the bed, but it helps the drainage not go back up into the head, but down through the neck. There's lymph drainage down here, bypasses the stomach and out through the digestive system, so it's not constantly going back in the head at night. That definitely helps. Trust me, it helps me too. It helps my daughter. I've done this with my daughter. It definitely helps. Massage through a warm compress, whether that be a rice bag, a heating pad, that helps the fluid drain. So just putting the heating pad around the neck or that rice bag that's warmed up in a microwave works. You can massage and massage down. It helps relieve that pressure down through the ears and down through the neck and down through into the digestive system. Warm olive oil drops, garlic ginger drops, naturopathic drops do the trick. Vitamin D promotes immune system, and even getting out and playing, and that is working too. So getting out and getting that sun. You know, vitamin D, there's like and I forget, and I do apologize. There's an active form of vitamin D, and if we're only taking the inactive form, the sun actually converts the vitamin D to an active form. So you still need the sun to produce an active form of vitamin D. If anybody out there knows what the active form, vitamin D3 or vitamin D4, please let me know. But I know the sun has to activate the active form. Diet's a big one. We talked about that before. You know, decrease the dairy, decrease the sugar, increase the veggies, increase the fruit, increase the orange juice loaded with vitamin C. Play, moving outside, getting that body temperature. I gotta tell you, anytime that I feel ill, it's gonna seem like I don't feel like moving, but I get up and walk, move. I get up and get the fluid in between the cells have to move, and it detoxifies the body. It pushes that out in the body too. And we this time of year when we're not moving as much because the sun goes down more, we're breathing recycled air, we're not drinking as much fluid. This is importantly to help. And you're gonna say, Dr. Randy, you know what? We've looked all this stuff up on the internet. We've tried this. We tried even tube surgery because I have testimonials of 2 kids, a brother and a sister, that have done 6 tube surgeries and it still didn't work. They're still getting ear infections. And we tried that. We are at a loss. We do not know what to do as parents, and we're on the struggle bus to help our child. So let's talk about chiropractic care. I see this as twofold. Not only does it help the immune system function better, but it also helps that drainage, that muscle tone to relax. And it's usually found at even C2 down to even C6. We get those nerves working so much better, the immune system really lights up. It decreases the muscles. So when I feel like even kids that come in and they feel like little lumps in their neck and like a lot of lumps, or it feels like a water balloon, I know, hey, they're more prone to an immune system. And I ask the case history, hey, was there any problems at birth? And they're gonna say, oh yes, you know, baby's at forceps, baby had torticollis as a child, is a big giveaway that, you know, ear infections are knocking at their door later in life as well. So for me, what I do is I want to look at those scans. I want to see how that nervous system is functioning so I can interpret that. Because these computerized scans measure the nervous system, measures muscle activity, and it also allows me to tell the story of why the child is having ear infections. So if this video is helpful for you, if you know somebody that, hey, like, oh my gosh, my grandchild is having ear infections, I know somebody that has ear infections, by all means, reach out. Please comment. Talk to me. Let's figure out if chiropractic is the right choice for you and your child, and help make you understand so you can even understand this more as far as a natural way to help these ear infections, but most of all, help you feel confident as a parent to help your child. Hey, I'm Dr. Randy Wirtz in Thrive Chiropractic. Have a blessed day. Bye-bye.